Many thanks to Mr. Littman for helping to set the tone for the day. Thank you very much. Our next speaker, Ms. Sophia Leon de Barra, works as a statistical consultant for the Department of Preventive and Social Medicine, as well as the broader Health Sciences Division here at the University of Otago. Her interests are as diverse as the researchers she collaborates with. Current projects include work in physiotherapy, sexual health, psychiatry, cardiology, and active transport. Today, she will be sharing recently compiled data about how teens travel in Otago. Please welcome Sophia Leon de Barra.
Tēnā koutou katoa. I'd just like to begin by acknowledging the traditional custodians of the lands we're meeting on here today, as well as acknowledging my colleagues, Sandy Mandick and Tony Moore, as well as our colleague from the Dunedin City Council, Charlotte Flaherty, and our research assistant, Claire Hodge. So in this study, we're utilizing a multidisciplinary approach between GIS surveying, physical education, and preventive medicine to better unpack the transport decision-making among adolescents here in the local context of Otago. So we'll be examining both the personal and social influences as well as the geographic ones, physical activity behaviors, and household behaviors. So why active transport to school? Why is this our framework? Well, first of all, as a public health practitioner, I believe it's an affordable and practical health intervention. As Dr. Todd alluded to, it's a very cost-effective approach. It also is an effective way of reducing chronic illness, reducing obesity, and increasing physical activity. And so why are we choosing to focus on adolescence? Well, with adolescence comes autonomy and our personal decision-making. So we believe that by establishing personal behaviors at a young age, such as in adolescence, these are the ones that we're most likely to carry with us into adulthood. So in the study we're looking at today, we'll be looking at the online Otago School Students Lifestyle Survey, which was collected in 2009. It canvassed 19 of the 23 secondary schools in the Otago region and approximately 2,000 students with an average age of 15 years old. 73% of these students came from an urban environment and 52.8% of them were boys. This was about an hour-long online survey that covered everything from physical activity to dietary habits, transportation, the physical environment, as well as social and environmental determinants. So for our data analysis, we use both descriptive statistics and a multivariate binary logistic regression model approach to comparing active transport versus motorized transport among adolescents to school. So the conceptual framework for this study included personal, social, and environmental determinants. The personal determinants that we looked at were socio-demographic characteristics such as age, gender, New Zealand deprivation scores, and BMI. Behavioral patterns we examined were along the guidelines for screen time, including screen time with computers, television, and consoles, and looking at students who meet the guidelines less than 2 hours per day, as well as those who meet the physical activity the screen time guidelines are 60 minutes per day, and the screen time guidelines are less than 2 hours of screen time per day, and the physical activity guidelines are over 60 minutes per day. So looking at the students that meet those behaviors, as well as the motivations and barriers to active transport, such as exercise, socializing with friends while walking, any time constraints that may be associated with travel. And then in the social realm, we were looking at peer support, such as encouragement from friends, school factors, such as the school decile, co-educational schools, and family resources, such as the number of screens, cars, siblings per household, access to a bike, that kind of thing. And in terms of environmental factors, we were comparing urban and rural students, looking at the built environment, things such as distance to school, as well as personal and parental perceptions around safety, whether the students and their parents perceived it as safe to be outside, if active transport was perceived as a safe way of getting to school. So the result of our survey is we discovered that 39% of adolescents traveled to school by car, 24% by bus, and 37% by active transport. Among those who were active commuters, 92% of them were walkers and 8% were cycling. There were a few surprising associations between self-reported BMI and sport. Obese students were found to be more likely to use active transport than a bus or car, and students participating in organized sport were less likely to use active transport to school. So we'll discuss this a little bit later in the implications, but first we'll look at the results for the overall study and the regression models for transport decision making. So the greatest motivation for use of active transport to school was my journey gives me exercise. For me, this was a bit of a surprise because it seems like such an obvious thing. Obviously, if you're walking or cycling, it's going to provide you exercise, but I'd never thought of it as a strong motivational factor. However, those who perceived the benefits of exercise in the survey were 12 times as likely to use active transport to get to school. Also, the greatest barrier to walking or cycling to school was the perception of a time constraint. Students who perceived time constraints associated with active transport were twice as likely to walk or bike to school. In terms of social and household factors, there was a small association with fewer screens and vehicles associated with active transportation. In terms of environmental determinants, rural students were more likely to use active transport than urban students, with 47% of rural students actively commuting compared to 34% of urban students. And when we looked at environmental factors, the greatest determinant of active transportation behaviors was the distance to school. We found that pretty much there was the optimal sort of distance for traveling to school at around 2.5 kilometers, whereas, so if you look at this sort of radius, you can see that the active commuters are on average only traveling 1.4 kilometers versus the ones traveling by motorized transport traveling 8.3 kilometers. So you can see that there's a big discrepancy in terms of the distance that active commuters have to travel. However, if we used a rock curve analysis to look at sort of what's the optimal distance for traveling by walking or cycling, and we found that about 75% of students who lived within a 5-kilometer radius would walk or cycle to school, with an optimum cut point of around 2.5 kilometers. And finally, parental perceptions of safety were also important since they doubled the likelihood of ATS use. So in the multivariate model that we just examined, we only accounted for distance in terms of the built environment. The existing literature suggests that 4.8 kilometers is the optimal cut point. However, that's based on literature from North America. So as I described previously, if you look at the 4.8 kilometer radius, you see that beyond 4.8 kilometers, you only see 2% of students walking or cycling, so almost nobody, whereas within the 4.8 kilometers, you see 56% of students walking and cycling. However, when you use the optimal cut point of 2 kilometers, you see that 81% of students are actively commuting to school. So that's a huge increase. When we examined other factors from the built environment and GIS data, we compared total altitude gain. So in a city such as Dunedin, where there's lots of hills, you can see that the active commuters are making a total altitude gain of 22 meters compared to those traveling by motorized transport of 158 meters, as well as the number of intersections on the route home. Active commuters experience less intersection density compared to motorized transport. However, active commuters came from higher residential density areas with greater counts of houses within the 400-metre radius of their home. So, in conclusion, we can surmise that geographic distance and location do matter. The greater the geographic proximity to one's school, the more likelihood that someone will walk or cycle there. Students who use active transport are highly motivated and do it for exercise, whereas students who use motorised transport do it to save time, often because they're travelling greater distances. Household resources, parental perceptions of safety are important, but less influential than the geographic determinants and the motivations and barriers. So in terms of what are the implications for public health policy, I believe that future health promotion campaigns should be targeting adolescents and focus on exercise as a key motivation and benefit for active transportation to school. It was really encouraging to see that there were higher rates of obese students walking to school. So that is potentially an indicator that this could be a successful health promotion campaign for reducing obesity in our community here. I was also surprised to see that the students who were participating in organised sport were less likely to be active commuters, because that was an association that I would have expected to see. However, I think that could have to do with infrastructural reasons and it being difficult for students to ride a bicycle from their school straight to their sports practice. So that could, we'll explore that further as we continue to survey students here in Otago and explore what the barriers are in terms of their transport behaviours, because we will be collaborating with council in terms of infrastructural developments and how we can make active transport more accessible to young people in our community here. And I'd be happy to field any questions from the audience.
Are there any questions for Sophia? Thank you. Yes.
Yes, I wonder, did you or could you look at, for those people who I suppose lived in or had optimal conditions for participating in active transport but didn't, so for example lived close, relatively flat, high BMI, parents perceived them as safe, but didn't engage in active transport, could you analyse, or maybe you have already, what are the differences between those who do and don't, and perhaps start to tease out the barriers for people participating in active transport?
Yeah, well, as discussed in the multivariate model, once you account for the factors of distance, and perceptions of safety, really it comes down to those perceptions of barriers and motivations. So the key difference there for those students who live within the distance would have been those who perceived the benefit of exercise compared to those who didn't. However, as you saw with 83% or 81% of students living within that 2.5 kilometre radius, most of the students who are in that optimal distance are already walking to school.
Okay, thanks.
Yeah.
Yes, Ben.
Hi. I wonder if distance is the right thing, and I'd love to see if you're able to this translate into time, because the time to walk 2.5k is about the same time as it takes to ride 8k at a very leisurely pace. So it changes the whole distribution and separates the active transport into biking and walking as quite distinct activities.
Yeah.
Is that possible with your data set?
Yeah, well, actually, in our original analysis, we used data collected from the Google Maps, which provided us with the estimated walking distance as well as the estimated walking time. And when we included that in the model, it had a similar capability for prediction as the distance. However, it obviously is interrelated, so it tended to omit one variable or the other, but it had a similar ability to predict for active transport behaviour.
I think what Ben's also trying to get at here is there's still a low cycling mode among the students that you surveyed.
Yeah.
And even though there's fairly short differences, were you able to uncover some of the barriers to cycling amongst that group, because that would have increased their ability to cover some of the distances and reduce the time?
Yeah. Well, unfortunately, this survey didn't really explore in depth what the barriers were for cyclists compared to walkers. However, in the next survey that we'll be implementing in the next year, we will be exploring more what those issues are in terms of barriers and motivations specifically for cycling as compared to walking, as well as unpacking transport for skaters and scooters as well.
Other questions? We have a bit of time. Is that it? Nothing else? Thank you very much, Sophia. That was excellent.